Welcome to our video on the mysterious and often perplexing world of dreams and nightmares. Have you ever wondered what causes the vivid, sometimes strange, and often emotional experiences we have while we sleep, or why we sometimes wake up feeling rested and refreshed, while other times we wake up feeling anxious or distressed? In this video, we'll explore the science behind these phenomena and discover what's happening in our brains and bodies when we dream. We'll examine theories on the purpose of dreams, delve into the common themes and symbols that appear in our dreams, and look at the factors that can influence the content of our dreams. We'll also discuss nightmares, what they are and what causes them, and provide some tips for managing and coping with these unsettling dreams. So join us as we embark on this journey into the science of dreams and nightmares. Understanding these phenomena can not only be fascinating, but it can also help us to better understand ourselves and our own minds. Dreams are a natural and universal phenomenon that occur during sleep. They are characterized by a series of images, thoughts, and sensations occurring in a person's mind during sleep. Dreams can be vivid and immersive, and they often have an emotional or narrative quality. Dreams can be shaped by a person's memories, experiences, and unconscious desires, and they can sometimes include elements of the surreal or the impossible. Nightmares are a type of dream that is typically disturbing or frightening. They can cause a strong emotional response in the person experiencing them, such as fear, anxiety, or sadness. Unlike regular dreams, which often have a disconnected or random quality, nightmares usually have a clear and cohesive storyline. They may be triggered by stress, trauma, or certain medications, and they can cause the person to wake up feeling distressed or upset. Understanding the science behind dreams and nightmares can be interesting and useful for a number of reasons. Here are a few. Personal curiosity. Many people are naturally curious about the experiences they have while sleeping, and understanding the science behind these phenomena can help to satisfy that curiosity. Self-awareness. Understanding how and why we dream can give us insight into our own minds and emotions. It can help us to better understand our own thoughts, feelings, and behaviors, and it may even allow us to gain a deeper understanding of ourselves. Problem solving. Dreams have been shown to play a role in problem solving and creativity, and understanding the science behind this process can help us to harness the power of our dreams to come up with new ideas and solve challenges. Coping with nightmares. Knowing more about the causes and triggers of nightmares can help people to identify and address the factors that may be contributing to their nightmares. It can also provide strategies for managing and coping with these disturbing dreams. Sleep health. Understanding the stages of sleep and the role of dreams in sleep can help people to optimize their sleep habits and get the rest they need to feel rested and refreshed. During sleep, the body and brain undergo several changes as a person progresses through different stages of sleep. There are two main types of sleep: rapid eye movement REM sleep and non-REM sleep. Non-REM sleep is further divided into three stages. Stage 1 light sleep. This is the transition stage between wakefulness and sleep. The brain waves become slower and the muscles begin to relax. Stage 2 deep sleep. This is a deeper stage of sleep, characterized by slower brain waves and a further relaxation of the muscles. Stage 3 deeper sleep. This is the deeper stage of non-REM sleep, and it is characterized by extremely slow brain waves called delta waves. After completing a cycle of non-REM sleep, the body enters REM sleep. During REM sleep, the brain becomes more active and the muscles become paralyzed. This is the stage of sleep when most dreaming occurs. The body cycles through these stages of sleep several times throughout the night, with the majority of REM sleep occurring in the latter half of the night. The length and characteristics of each stage can vary depending on a person's age, lifestyle, and overall health. There is still much that scientists do not understand about the function of dreams, and there are several theories that have been proposed to explain the purpose of dreams. Here are two of the most well-known theories. The cognitive psychological theory. According to this theory, dreams serve as a way for the brain to process and make sense of information and experiences from the day. Dreams may help to consolidate memories, integrate new information, and solve problems by combining and rearranging existing knowledge in novel ways. The activation synthesis theory. This theory proposes that dreams are a byproduct of the brain's attempt to make sense of random neural activity that occurs during sleep. The brain creates a story or image from the random signals, resulting in the dream. According to this theory, dreams do not serve any particular function, but rather are a way for the brain to keep itself occupied during sleep. There is evidence to support both of these theories, and it is likely that the function of dreams is complex and multifaceted. Dreams may play a role in memory consolidation, problem solving, and emotional regulation, among other things. However, more research is needed to fully understand the function of dreams. Content of dreams can be highly individualized and can vary greatly from person to person. Dreams can be shaped by a person's memories, experiences, and unconscious desires, as well as by cultural, personal, and social factors. Some common themes that appear in dreams include falling, being chased or attacked, being lost or searching for something, flying or floating, being late or missing an important event, being naked or exposed in public. Dreams can also include a wide variety of symbols and imagery, such as animals, people, objects, and settings. The meanings of these symbols and images can be highly personal and can be influenced by a person's culture, beliefs, and experiences. In addition to these common themes and symbols, dreams can also include elements of the surreal or the impossible, such as talking animals or objects, or bizarre or impossible situations. Overall, the content of dreams can be highly individualized and can be influenced by a variety of factors. Understanding the content of one's own dreams can provide insight into one's own thoughts, feelings, and unconscious processes. Nightmares are a type of dream that is typically disturbing or frightening. They can cause a strong emotional response in the person experiencing them, such as fear, anxiety, or sadness. Unlike regular dreams, which often have a disconnected or random quality, nightmares usually have a clear and cohesive storyline. Some common features of nightmares include a clear and coherent plot or storyline, intense negative emotions, such as fear, anxiety, or sadness, a feeling of being threatened or in danger, a sense of helplessness or lack of control. Nightmares differ from regular dreams in that they are more likely to cause a strong emotional response and to be remembered upon waking. They may also be more vivid and realistic than regular dreams. Nightmares can be triggered by a variety of factors such as stress, trauma, and certain medications. Stressful events or situations such as a difficult job, a major life change, or a traumatic experience can trigger nightmares. Stress can disrupt the normal sleep cycle and increase the likelihood of experiencing disturbing or anxious dreams. Trauma. Nightmares are common in people who have experienced a traumatic event, such as a natural disaster, a car accident, or a personal assault. These nightmares may be a way for the brain to process and cope with the trauma. Certain medications. Some medications, such as certain antidepressants and blood pressure medications, can cause nightmares as a side effect. Mental health conditions. People with certain mental health conditions, such as anxiety or post-traumatic stress disorder (PTSD), may be more prone to experiencing nightmares. Substance abuse. Alcohol and drug use can disrupt the normal sleep cycle and increase the likelihood of experiencing nightmares. Medical conditions. Certain medical conditions, such as sleep apnea, can also cause nightmares. It is important to note that not all nightmares are caused by these factors, and the underlying cause of a person's nightmares may not always be clear. In some cases, the cause may be a combination of factors. Here are a few techniques that may help to manage and cope with nightmares. Relaxation techniques. Practicing relaxation techniques, such as deep breathing, meditation, or progressive muscle relaxation, can help to calm the mind and body and reduce the frequency and intensity of nightmares. Keep a dream journal. Keeping a dream journal can be a helpful way to track patterns in your nightmares and to identify any potential triggers or themes. Writing down your dreams as soon as you wake up can also help to preserve the details and emotions of the dream, which can be useful for understanding and interpreting the meaning of the dream. Avoid drugs and alcohol. Substance abuse can disrupt the normal sleep cycle and increase the likelihood of experiencing nightmares. Avoiding or reducing the use of drugs and alcohol can help to reduce the frequency of nightmares. Get enough sleep. Adequate sleep is important for overall health and well-being, and it can help to reduce the likelihood of experiencing nightmares. Talk to a therapist. If you are experiencing frequent or particularly distressing nightmares, talking to a therapist or mental health professional can be helpful. A therapist can help you to identify and address any underlying issues that may be contributing to your nightmares and can provide additional coping strategies. It is important to note that these techniques may not work for everyone and that the best approach for managing and coping with nightmares will depend on the individual and the underlying cause of the nightmares. We hope that this video has provided some insight into the science behind dreams and nightmares and that it has sparked your curiosity about this topic. If you'd like to learn more, there are many resources available online and in books that delve deeper into the science and psychology of sleep and dreams. We encourage you to consider the role of dreams in your own life and to pay attention to your own dreams as a way of gaining insight into your thoughts, feelings, and unconscious processes. If you enjoyed this video, please be sure to subscribe to our channel, give it a like, and share it with your friends. We appreciate your support and look forward to bringing you more engaging and informative content.